Karen's been nominated for this award because of the fantastic work that she does for patients here in Dudley. She's an educator. She helps staff, both non-clinical and clinical, to understand how to give the best care to patients at end of life.
I lost my mum 8 years ago and I wanted to get into end-of-life care to make experience for patients and other carers better than what I had. The focus of my job is to upskill generally staff in end-of-life care, so that includes everybody that involves that journey for the patient.
It's really important that patients receive care from staff that understand what their needs are and what they're going through. So what Karen's been able to do is to work with staff across the board to help with educating them to understand what the needs are of patients and families as they go through this difficult time.
Since gaining the role, we've scoped education across the health economy, including social services and the local hospice, and we've now got 72 end-of-life care champions, which we've done a programme of teaching for, and then it's up to those champions to cascade to other members of their team, so hopefully we upskill everybody working in Dudley with end-of-life care. We have got a programme for junior doctors, and we've also got a programme for nurses. We've also got a programme for non-clinical staff, for porters, volunteers and admin people, because we recognise in Dudley that everybody has communications with patients at end of life and they're all very valuable.
The training that Karen's provided for the nurses here at Russell's Hospital has been really beneficial for patients and the relatives. It's been able them to show empathy towards end of life and manage the symptoms more effectively.
One of the things that Karen does extremely well is that she helps staff to deal with some of the difficult conversations that they're going to have with patients in terms of breaking bad news, for example. And the work that she does helps to give those staff, the young doctors and nurses, the confidence to be able to handle those conversations.
I hope what we've done is upskill the generalist staff, so if any patients or carers ask anything about their journey, they should have an answer that they deserve to have.
She carries out her work to the highest level and the highest standard.
If ever we need Karen in emergency or even just somebody to advise us, she's always there and she's always happy to help.
The best thing about Karen and her work is that she's making a real difference to patients, to cancer patients here in Dudley.